Welcome back to the Wellness Point. We talk a lot about long-term health, but what about those critical seconds when an emergency strikes? We all want to help, but what if the advice we learn from movies, or even from well-meaning relatives, is dangerous? Today, we're rebusting one of the most critical first aid myths out there, a piece of advice that could do more harm than good during a heart attack. This isn't just a rumor, it's a doctor's urgent warning. Pay close attention, because this knowledge is power. Part 1. The Myth Unmasked. So, let's get right to it. The myth we're rebusting today is the advice to take an aspirin at the very first sign of chest pain, and to lie down and wait for it to work. Now, let's be clear. Aspirin is a fantastic, life-saving drug. In a confirmed heart attack, it helps thin the blood and prevent further clotting. But the critical mistake is in the timing and the action. The lie down and wait part? That could be a deadly delay. Here's the reality from a medical perspective. A heart attack is a race against time. Every minute that a blocked artery starves heart muscle of oxygen, that muscle begins to die. It's damage that can be permanent. The single most important goal is to get to a hospital as fast as possible, where doctors can perform procedures to open that blockage. When you lie down, you are not getting to the hospital. You are waiting, and heart muscles are dying. Furthermore, while aspirin is generally helpful, it's not for everyone. What if your chest pain isn't from a heart attack, but from a different, equally deadly problem like an aortic dissection tear in your main artery? In that case, a blood thinner like aspirin could make the bleeding much, much worse. You shouldn't be playing doctor, you should be getting to one. Part 2. The why behind the danger and the right actions. Host. So, why does this myth persist? It's because it contains a kernel of truth. Aspirin is used, but it's the context that matters. It's not a magic pill you take instead of going to the ER. It's something a paramedic might give you on the way to the ER, or that the ER doctor will give you after a quick assessment. So, let's replace the myth with the right actions. This is your Wellness Point action plan for a suspected heart attack. Knowing what not to do can be just as important as knowing what to do. If this critical myth busting has been an eye-opener for you, please support our mission to bring clear, trustworthy health information to everyone. Help us out by hitting that like button, and make sure you subscribe to the Wellness Point. Your support helps this life-saving information reach the people who need it most. Now, let's finish up with one final, crucial point. Step 1. Recognize the signs. We all know chest pain is a sign, but a heart attack can be sneaky. It's not always a Hollywood-style, clutch your chest and collapse moment. Especially for women, symptoms can include a shortness of breath, a nausea or vomiting, a pain in the jaw, neck, or back, a cold sweat or feeling dizzy. If you feel an unusual, crushing pressure or squeezing in your chest, or any combination of these symptoms, it's time to act. Step 2. Call 911. Immediately. This is the most important step. Do not drive yourself. Do not have someone else drive you unless an ambulance absolutely cannot get to you. Why? Paramedics can start life-saving treatment the moment they arrive. They can do an EKG, give oxygen, and manage complications that can happen on the way. In the ambulance, you are already in the chain of survival. Step 3. While waiting, stay calm and rest. Sit down in a comfortable position, or lie down if you feel faint. Loosen any tight clothing. The goal is to reduce the workload on your heart. Do not eat or drink anything. Step 4. About the aspirin. The current American Heart Association guidance is this: if you are not allergic, and a healthcare professional has not told you to avoid aspirin, then after you have called 911, the 911 operator may tell you to chew one regular, uncoated adult aspirin, 325 milligrams. Chewing gets it into your bloodstream faster than swallowing it whole. But let me be perfectly clear. This is done only after 911 has been called and if the operator instructs you to do so. You are not making that decision on your own. Part 3. Become a first responder of knowledge. So, let's recap. The old advice to just take an aspirin and lie down is a dangerous gamble. It delays professional care and can be wrong for certain conditions. Your new, empowered response is simple. 1. Recognize the often subtle signs. 2. Call 911 first. It's your fastest path to treatment. 3. Follow the instructions of the operator. Don't let a myth cost life. Share this video with your friends and family. Have a conversation about it over dinner. By updating our knowledge, we all become better first responders, ready to act wisely and decisively in a crisis. You don't need to be a doctor to save a life. You just need the right information. We've left a link in the description to the American Heart Association's official resources for more information. What was the biggest surprise for you today? Let us know in the comments below. Stay informed, stay empowered, and thank you for making your wellness a priority.